I pretty much felt that I had cancer. They took out 14 lymph nodes, 5 of them were cancerous, and 1 was a little more involved. And so that's when they staged it, at stage 3. In April of 2013, I had a clean mammogram. And in August, I found that when I laid on my left side, there was a little bit of throbbing. And when we went to our family practitioner, he didn't find anything either, but he humored me and wrote another mammogram order.
So in Carolyn's case, even though some initial imaging was not very clear about her diagnosis of breast cancer, she persisted and elected to come to Moffitt to have us investigate things further. And upon further review and investigation, we did make the diagnosis of breast cancer, and then she chose to keep her care here.
When you know something, you know that you can do something about it. So you get this new diagnosis and, okay, now I know what I got, let's deal with it.
Moffitt Cancer Center is a pioneer for breast cancer screening and services due to our state-of-the-art technology as well as an interdisciplinary approach to breast cancer screening, prevention, and treatment.
Digital mammography is something that is the newest and probably the most reliable method of screening mammography out there.
3D mammography is really revolutionizing the field of breast cancer screening. It uses similar technology to a mammogram, but it slices the breast. So it's essentially like slicing a loaf of bread or reading pages in a book where you don't have a lot of that tissue overlap and you're able to see the individual portions of the breast more.
Moffitt has a whole breast screening ultrasound capability that's pretty uncommon. We don't find those units in most places.
Women who have undergone mammography screening that have been referred to automated breast ultrasound after a 2D mammogram, large studies have shown about a 35% increase in invasive cancer detection. These cancers are small, they typically have not spread to the lymph nodes, so the preliminary results are very, very promising.
I think the single most important thing a woman can do in the detection of breast cancer is to be aware of her breasts.
I can't understate the importance of getting your annual mammogram. I recommend annual mammograms to start at the age of 40 or sooner if you have a first-degree relative that was diagnosed with breast cancer premenopausal.
The more focus that is placed on breast cancer allows us to have more research, and that will allow for there to be better treatments that we can then give to patients to have better outcomes.
And it's just wonderful to know that all these brilliant people are working on this for me and everybody else.
To learn more, call 1-888-MOFFIT or visit moffitt.org.